Okay. Good afternoon, everyone. It's 101 Central Time. That means it's time for emergency preparedness support for hospice and home health throughout Mississippi and Louisiana. And I want to welcome you all today and hope you have um, a pleasant and safe and cool and hydrated 4th of July weekend coming up. We are going to be focused in on Region 3, which is Southeast Louisiana, Lafourche, St. John, St. Charles, St. James, St. Mary as well, Assumption and Terrebonne parishes. And we have the support folks from ESF 8 in Region 3 today to help us understand some of the challenges and things that they will need this hurricane season from you, the provider community, in the event that there's some sort of mandatory evacuation of the coastline. Um, let's start off with these are the regional leaders for GOSEF so that you'll have this information. I want to remind everyone at the end of today's session, all of these slides will be turned into a PDF and I will attach that into the calendar invite that you have for today's session. It will be in that shortly after today's meeting. And then I was given this wonderful creation for Louisiana parish directors and GOSEF, and I have to tell everyone I went to FedEx and had it blown up as a poster, and it's now sitting or attached to the wall right over my desk in case I need any of this information this hurricane season. So these are the important contacts in the event of some sort of emergency. And I really encourage all of you to click on the hyperlink to it. It'll take you to the PDF. You can have it blown up so that you can blow it up and you'll see the different regions within your service areas and the contacts for those different regions. When we're talking about Region 3, we have ESF 8, which is the support functions for medical, and that is going to be Dr. Brooks, Charles Kanan, Ashley Betts, and Tara. Who else is sitting with us today in ESF 8?
Paulo Gagliano, DRC EMS.
Thank you. Thank you for being with us. Anybody else that I didn't mention?
You also have Ashley, myself, Charles Canan, and Kim Beats are here together, and we should have Lori Gallagher, the Home Health and Hospice DRC as well on the call.
I think Lori is with us. I know she was on vacation last week. Lori, are you with us? Well, we'll go on. These are your emergency managers for each parish. So if you have patients in these parishes, these are the folks that you need. I'm sorry. These are the folks that need to have your emergency plans. I don't know why it's not staying. These are the contacts. These are emails. Their telephone numbers, their websites. But you have to submit your plans anytime there's a change in your emergency plans to the emergency managers in the parish in which your agency is located. We suggest that you send those plans to every parish where you have patients, that you're servicing patients within your service area, because each parish is doing things a little differently. They have, their own nuances, and you need to know what those are that are going to affect your patients in their parish. So just to give you an idea how large this region is, here we go. We have almost 300, we have over 300,000 people that live in this region, and almost 56,000 of which are over the age of 65. We have 1,100 hospice enrollments, 1,700 hospice enrollments that happened last year. Oh, and most of those patients were in hospice for about 31 days. When we talk about 1,700 hospice patients, you have 3 times that number of home health patients in Region 3. And then we're dealing with Region 3 deals with over 3,000 deaths each year, of which hospice is a very small portion of that, with regards to about 1,217 hospice deaths in last year in 2025 in Region 3. With regards to the at-risk registry, which is our basic way of communicating who our patients are that would need particular assistance in the event of a mandatory evacuation, these are the numbers that we have with regards to in Assumption Parish. There's one agency that is reporting, one agency that has patients that are not up, that were not updated last week, and these are all based upon last week's reports. Lafourche, there were 5 agencies that had patients that were updated, and 5 agencies that had not updated patients as of last week. St. Charles Parish, I want to say every one of the St. Charles Parish patients were updated last week, which was unusual, but very good. St. James, half were updated and half were not. St. John, 7 were updated. 2 were not. St. Mary, 3 agencies did the update, 6 did not, and Terrebonne was 4 and 4. The 4 agencies were updating, 4 agencies did not. So we're talking about 78 patients in Region 3 were updated last week, but another 48 patients were not. And then we're showing how many patients that were missing weight, how many patients in each parish are missing a zip code or missing a date of birth. All of these things are important, and we'll get to why they're important in just a little bit. I went back and I looked at last year's numbers just to see where we were at this point. And last year, in August, you had identified some 225 patients in the registry that would need assistance. As of this last week, you've only identified 126. Now, I'm not complaining that there are fewer patients needing assistance at this point in the hurricane season. However, I do want to point out that we need to identify patients as early as possible in order for emergency managers to even be aware of their existence. And that's the important part that the at-risk registry plays for providers, is that it gives emergency managers ideas as to who's out there that would need assistance and where they're located. So there's a difference of 99 patients that were on service last year that aren't on service this year. And I just want to make sure that those agencies that did not do the update last week, that you're aware of the need for you to keep the registry updated so emergency managers know. They can plan ahead. As they say, blue sky planning, as opposed to dumping patients on these managers at the last minute. So overall, we have 2,200 patients in the registry, of which only 1,400 have been updated as last week. 800 have not been. I need everybody throughout the 2-state area to do the update on these patients. We have 592 patients that were updated last week that did not have weight. the weight was missing from their profile. We had another 196 patients that were missing zip codes and 78 that were missing the date of birth. And all of those all of those values are important in an actual emergency with regards to the patient's weight, as well as their zip code and their date of birth, because many parishes use the date of birth and the zip code as a unique identifier for patient confidentiality, as what have you. There are some lessons. I've been talking about this ever since the experience, but we had a tabletop exercise in Region 1 in April to try and figure out how we were going to make sure that patients that needed assistance were going to get the assistance, home health and hospice patients, in addition to other registries that parishes were keeping with regards to people who aren't on hospice or home health, who were calling in saying we would need assistance as well. So the registry is an important tool, but it's one tool that parishes are using to identify vulnerable patients within that parish. Things that we discovered that slowed down the process with regards to the at-risk registry were that it was missing weight, date of birth, and zip codes. Those three things are important factors that emergency managers need in an actual emergency to keep track of these patients. One other thing that we learned was that when they called an agency to get information about patient information that was missing, they would call the agency number. The receptionist inevitably did not know what to do with the call. This is why it's important that agencies educate your receptionist, especially your receptionist who's answering the phone. If they say it's an emergency manager, emergency managers for the region or the parish, they need to know who to send that call to. And during the exercise, all of the receptionists didn't know what to do with the call. We had gotten secondary numbers for the DONs so that when we couldn't get through to an emergency manager via the receptions, we would have a direct number. And unfortunately, the numbers that emergency managers use to connect with the agencies are their own cell numbers, and so people didn't recognize those cell numbers, and the DONs weren't answering their phone. So these are gaps that we have to close in the event of an actual emergency. And finally, patient information was inconsistent, in terms of the way you were describing some patients being both bedbound and ambulatory. There are two different columns, or asking you the question in different ways. Be consistent with the patient, with the information. So having that introduction, I'm going to turn it over to the folks in we're in Region 3. I'm not sure where y'all are sitting. Are y'all in Thibodeau or Houma?
Yeah, we're in Thibodaux, Louisiana, at our Office of Public Health Regional Administrative Office, which doubles as our primary EOC location as well.
Thank you. And I'm going to turn it over to you, Charles, to lead us through this, your slides for Region 3.
Okay, well, good afternoon, all. My name's Charles Canan. I am Region 3 Public Health Emergency Response Coordinator. I work under our Regional Medical Director, Eric Brooks, and our Regional Administrator, Kayla Guerrero. I do have some changes to my team this year as the grant has ended for Andy Sheffield, and Kathy Robinson has taken a position with Health Standards. So at the moment, my emergency preparedness team is myself. We also have Amanda Falgu as our regional nurse manager. We do have some changes in our state leadership as well over the last year or so. GOSEP is now under the Louisiana Military Department, with Louisiana National Guard Brigadier General Jason Mafu serving as director of GOSEP, and Kim Beats is now our regional coordinator. Further, at the state level at Louisiana Department of Health, our secretary is Bruce Greenstein. Our Surgeon General is Evelyn Griffin. And LDH over the last year has assumed ESF6 and staff from DCFS. Ricky Monte currently is acting as state ESF6 and ESF8 lead. Our emergency preparedness director is now Natasha Seals, who comes from BCP, with Heather Gauthier as deputy director and Ashley Beats working as our ADRC. Next slide. So our slide deck objectives today, we're going to define ESF8, public health and medical. GOSEP breaks the ESFs down by discipline, and so LDH is the lead agency for public health. We'll talk about recent hurricane response, provide information on evacuation and sheltering residents with medical needs, and LDH's response roles and how we coordinate with local partners and state resources. Next slide. And so LDH works under our core functions for ESF8. So primarily, we're going to be one of 15 core emergency support functions established under the National Response Framework. Under public health services, we routinely undertake epidemiology, we perform contact tracing, we offer official guidance during public health emergencies, push out the health alert notifications to partners with important guidance. So if you're not on that distribution list, please make sure to get with me and I'll add you to our contact list. We manage care coordination by distributing supplies such as those in the Strategic National Stockpile and ensuring continuity of care for vulnerable populations. Triage and sheltering, mass fatality management. We work with our local governing entity for behavioral health support, our ambulance providers, EMS DRC for ambulance transportation assets. Also use those with shelter coverage and emergency response, and coordinate with regional and federal resources. Next slide. And so most recent hurricane response was 2 years ago, Hurricane Francine. During that event, we activated our EOC. We provided liaison at our parish EOCs, situation updates to LDH leadership and up towards the governor. Hurricane Francine had rapid intensification and our disaster declarations were slightly delayed prior to landfall. Evacuation orders were issued and a handful of residents contacted Office of Public Health triage lines to find safe shelter. At the time, our medical needs shelters were not activated. We worked with community partners, notably Ochsner Medical Systems for patient placement. We worked with our DRC network for state ambulances who assisted in evacuation, then staged at general population shelters. We ensured status reporting of healthcare facilities, provided oxygen exchange, and called for medical assistance at local shelters, and also ensured those evacuated had a safe place to return to. Of course, we're a region that takes direct hits from the tropical storms quite frequently, and our aim is to move individuals and populations to safety. Next slide. And so medical needs shelters are a large focus of LDH's emergency preparedness response. So we'll talk about the triage process that takes to gain admission to those shelters. So we could be asked to open a medical needs shelters for smaller type storms within our region. The deputy secretary, in consultation with the LDH secretary, LDH emergency preparedness, governor, and GOSEP determines the opening and closing of those medical needs shelters in the state. And we'll go through the location and capacities with the next slide. The state runs and the local parishes can set up a lot of different type of shelter options. Primarily, the general population shelters are what we see most frequently. Those are often open locally, sometimes in disaster zones. They may be staffed by parish, Red Cross, or non-governmental organizations, and those are for the general public. The critical transportation needs shelters are almost the exact same thing as the general population shelters, but they're state-run, and those are for residents without transportation. The medical needs shelter is our focus today, and we'll keep discussing that further. The state also often opens the pet shelters. They've learned from past issues. The pet shelters are a big thing. They can be co-located next door to one of the above shelters. And in those cases, the pet owners are expected to tend to the animals And then sometimes they cohabitate the pet shelters too, where they place the pets in the shelters with the people, possibly caged. And so that's another option that they have. They also do the sex offender shelter to keep those residents safe and separate. And then point to point is one option that several parishes have where they prearrange with a parish in the south works with a parish in the north to send their residents to shelter out of harm's way. So I believe Terrebonne's working with Ouachita Parish and would send their residents up that way and work with their wraparound services as well. And next slide.
All right, I'll take care of both of those. Thank you, Joel.
And so in the region, we have two possible M&S sites. Only one of them's listed on this map, though. Our two possible locations are at the Assumption Community Center in Napoleonville. And then we have another option for at the nursing building at Nicholls State University, Betsy Sheremy IO Hall. The map only includes the pre-storm M&S locations. So that Nicholls one is considered mostly a post-storm location, so that's not on the map. It's more likely that we would evacuate residents to a shelter in another region, so it's important for us to work together to make sure residents with access and functional needs have a plan for evacuating. Next slide. The state maintains the mega shelter in Alexandria in a state of operational readiness. It's generally the first shelter to open in the state. If additional shelter space is needed, the state could potentially open shelter sites in Region 2, 7, 8, or fairly well anyway in the state. And then we have the pictures up there to show you that it's just that it's a shelter. It's not a vacation. It's not a cruise ship. It's more like a lifeboat, but it's a safe place to keep people through difficult events. Next slide. The medical needs shelters provide the refuge to individuals who may not be eligible for a general shelter because of their medical needs, but do not require hospitalization. They're shelters and not comfortable hotels. Admission criteria is generally for those with chronic medical conditions, but not acutely ill enough for hospital admission. And some examples include persons requiring assistance with IV medications, those that are equipment dependent, such as on a ventilator, or mental health diagnosis. Next slide. And following a disaster declaration, our staff will be placed on standby. And then the Deputy Secretary, Dr. Pete Krogan, determines activation and deactivation of the medical needs shelters. After we place our staff on standby, we could be notified that we would have to set up the medical needs shelter if activated in the region. But regardless, either which way, we'll begin our telephone triage processes until it's safe for our residents to return and demobilize. Next slide. And so seeing the timeline here, we'll begin monitoring the triage phone lines and prepared to set up the M&S locations within 84 hours of pre-storm, and the medical needs shelter ideally opening at 72 hours. And then the transportation accesses begin with patient movement at 60 hours. Next slide. And we'll discuss medical needs shelter triaging next, and we could go on to the next one too. So we want to make sure that residents with access and functional needs are admitted to the appropriate medical needs shelter location and not sent to the inappropriate shelters or healthcare facilities. All residents with the access and functional needs that require sheltering will need to be triaged, and all residents needing the medical needs shelter, regardless of whether they are going by private transportation, need to first call our OPH triage lines to make sure they meet criteria prior to going to the shelter. Region 3 will primarily use telephone triage lines as primary method to identify those meeting M&S admission criteria. The residents meeting admission criteria will be triaged through the telephone triage. They'll also be quickly re-evaluated en route and then re-triaged upon presenting at a medical needs shelter location. Next slide. And so here's a list of our telephone numbers, our triage lines that residents can call. Either right now during blue skies, you could call any of those numbers at the top and we put you on a list. You could also call my office directly. My phone number will be at the end of the slide. We'll also put you on the list and we'll coordinate with the parishes. And then if an activation is called a disaster declaration, we'll reach out to those residents specifically and make sure that they're taken care of as best that we can. And then once the disaster declaration comes out and we've been advised to open up our triage lines, we'll advertise those phone numbers on 211, on established media through our Bureau of Media Communication, as well as social media too, as well. And then there's the number on the side there. We can go to the next slide. And so residents who may require placement with the MNS can pre-register with the parish emergency management or the OPH-EP team. We've listed the triage phone numbers to call before the triage lines are activated. And then please note that St. Charles Parish triages their own residents. They will then notify LDH of who they have that needs to go to the MNS. When activated, LDH will advertise those triage lines, as I mentioned, through 211, news media, social media, and the BMAC website. And then we'll bring in our LDH nurses to staff those triage lines here at our regional administrative office. And those identified for MNS admission are placed on one of three lists. Either those need an ambulance transport, those that can use a paratransit vehicle, and then those that have their own transportation through private vehicles. Next slide. And then for those coming out of Region 1 or Region 3 going all the way to Alexandria, they're probably going to take a quick stop off at the bus triage at LSU's Ag Center in Baton Rouge. There they'll be quickly reevaluated, and if anybody needs to be removed for any medical reasons to probably go to a hospital or something, they'd pull them off there and get them to that next location so that they're out of our evacuating region. Next slide. And then once they arrive at the medical needs shelter, the evacuation's registration process is started and the admission process is completed once the individual completes that on-site triage. And then they'll have ESF6, LDH ESF6s, our shelter managers, and they'll register each person admitted to the MNS there. Next slide. And so discussing transportation to the MNS, the ambulance transport was one means. We get that list and provide it to the EMS DRC to dispatch the ambulance to pick up directly from their residents and transport straight to the shelter primarily. Those that need a paratransit transport option, the parishes in our region use their own buses to pick up residents at their homes once they're triaged. And then we will provide that list to the parish OSEP as well as our transportation cell at the state, who will then work with ESF1 transportation to coordinate that evacuation. Those with the private transportation that are referred to the medical needs shelter, if going by a private vehicle, let the triage nurse know and we'll alert the shelter to confirm placement to be prepared for you. And I'll prevent them from arriving at a shelter that's already at capacity. We can make sure they're going to the right place. Next slide. And then, so talking about medical care next, we can go straight to the next one too, Jamie. The medical care that we provide in, I think we went one too far. The medical care we provide in the medical needs shelter consists of medical services. They're fairly limited. First of all, we do the triaging to make sure we don't have the people that are too sick in the medical needs shelter. We also assist with activities of daily living, medical monitoring, assistance with IV medication, also assistance with medical supplies and equipment. A couple examples might be oxygen and/or bariatric beds. Next slide. And then as mentioned, we work with ESF6 and our other partners around the state for the wraparound services where they provide security. So make sure we have a safe environment. Transportation services, some examples might be towards dialysis treatments, to procure prescription medications, or for medical appointments. They can do nutritional support to include low-fat, low-salt diets, etc. Work with the LGEs for the behavioral health personnel. We do have some over-the-counter medications within the shelter, and then we'll talk about pharmacy services soon. OAAS, Adult and Aging Services, staffs at the shelter, so they can assist with applying for caregiver services. Can provide veterinary support and also discharge planning to make sure that the residents have resources that will help them as they move on through their disaster process. Next slide. And so as mentioned, the provision of prescriptions to shelterees, the OPH Pharmacy Service Program has identified local independent pharmacies as well as national providers for prescription needs in those shelter operations. Next slide. And that should include prescription pickup, drop-off, as well as prescription counseling, identification of any unknown medicine, and they'll also assist with insurance billing as well. And then additionally, during or following a disaster in Louisiana, pharmacists are authorized by the Louisiana Board of Pharmacy to dispense one-time refills, typically an additional 30-day supply. So that's something that a lot of members should get ahead on once they hear that disaster declarations come on out. Next slide. And I think this is a different look of all the emergency managers. I think on the one slide that you had, Jamie, with the emergency managers, you might want to update the St. Mary Parish OSEP. Make sure you got Ross Meyer in there. Gonna send a couple reminders too. Every storm is unique. We haven't had a lot of residents need to evacuate for Ida or Francine. So during Ida, only one medical needs shelter was opened and then none during Francine. So our challenges also occurred during the smaller storms where state or federal declarations are not issued. Evacuation orders may be issued for low-lying areas, however. Our residents continue to call our triage lines and request assistance with sheltering, especially for those that are electrical dependent or with extensive medical needs. We've been fortunate to work with an ad hoc collection of healthcare providers that has stepped up to assist with requests for safe shelter placement, but these processes are not clearly defined and rely on the goodwill of our healthcare facilities. Without a state declaration and medical need shelter activation, our options are limited. Our goal is to prevent an undue burden being placed on our local hospitals. For those home health and hospice providers, a strong reminder to be educating patients to let them know they need to bring all medication, equipment, assistive technology devices to the medical needs shelter. We do not have prescription medications in our shelter. So we don't have much equipment either. We have some, but not a whole lot. So we may have oxygen concentrators, but you should probably bring your own too. They need to have a caregiver as well. Highly recommended that we bring a caregiver. Our nurses generally work in public health units or health standards in different facilities. Other than providing patient care on a regular, we provide them additional training on medical needs sheltering, but nobody will know your resident as well as that caregiver will. For residents that are too sick for a medical needs shelter, we encourage home health and hospice agencies to work with their patient and patient's primary care physician to find place for sheltering prior to an event, especially important for vent patients and those that are unable to be on a cot. And finally, important to let your patients know that the medical needs shelter is a shelter of last resort, not an ideal place for individuals with significant access and functional needs. Next slide. And that concludes my presentation. Unless you have any additional questions, I can pass over to the team.
I do have one question. When we were talking about the telephone triage that takes place in these emergencies, I take it that individuals will be using their own cell phones to make that. In other words, if we get calls from unknown numbers during an emergency, we should actually answer those calls because it's not going to say LDH or triage line, correct?
I'd be hard pressed to say what comes through on the other end of a telephone, and we're always kind of having new equipment pop up. So I personally answer my phone, and I can always hang up on a spam call.
Right. Right. Well, what I'm saying is that you all may be calling using the individual cell phone as opposed to, uh, my point is the providers, when they get these calls needing information about their patients, it's not going to say LDH triage line. It's just going to.
It kind of could go either way. We have limited resources that we have. We have limited phone lines. A lot of time our staff grabs their
Okay.
own personal cell phone to make a phone call.
Right.
And then next thing I know, those residents are calling me up for the next week or two or month or year or two. That's it's a challenge, a burden, and a blessing.
One other question. If any of the professional staffs of our provider community wanted to volunteer for any of these medical needs shelters that you all may set up, uh, especially post storm, is there somebody that they should contact?
Yeah, we run a Louisiana Volunteers in Action program out of all of the regional OPH offices. So you could contact myself. Ideally, our hospital nurse coordinator, public health emergency response nurse runs that LAVA program, but she's out right now. But I can assist with that. So we have the LAVA program that we offer them some additional training, opportunities to engage with the community. And then we'll send out a call to those volunteers during a disaster. It works really good in some of the other regions, especially where they have established medical reserve corps. It'd be great if we could do a little better job of setting that up in our region. But yeah, those volunteers are a big help, and we appreciate any assistance we can get there.
Okay. Thank you. Keep that in mind. Any questions before we go further from the provider community, from providers who are online right now? About anything Charles has said? Or the process, that any particular issues that you're hearing from your patients with regards to what was just said? Okay. Charles, you want to, your rest of the staff, folks to weigh in on any issues or particular interest?
So I'll go ahead. So I'm Ashley Beats. I'm the Region 3 Hospital ADRC. As alluded to earlier, we have a rock star hospice and home health DRC in our region, Miss Lori Gallagher. She works with Haydale Memorial Hospice. She is just getting back from vacation, so she couldn't make it today. But I did want to let everyone know we are here to support you. We will be having a meeting next week, July 8th. I know Mr. Jamie is going to attend. It'll be from 9 to 12 at Terrebonne Towers, and it is for all of our ESF8 partners, healthcare community. We will have most of the OEP directors that you saw listed there so that we can all come together and collaborate. I know Charles usually does a good job of getting the durable medical equipment providers, dialysis providers to come, which is where we have a lot of the issues during a storm, is getting the durable medical equipment and dialysis services back up and running. So everyone's welcome to attend. And then another save the date that I'll throw at everyone, if you're interested, is August 20th from 1 to 4. We will be having a Region 3 downtime exercise. It is a utility downtime exercise that will be hurricane-based. Miss Lori is on my planning team, so while I know that hospice and home health providers don't typically have a facility with their patients that will experience utility failures, you do still have your patients that will be at home experiencing those same utility failures. So everyone's welcome to attend. Miss Lori's going to help us come up with some injects for you guys to kind of work through for your homebound patients in the event that they lost electricity or oxygen or what have you. And that's all I have from the ADRC perspective.
Thank you. If I'm available, I'd really like to attend that meeting, that
Absolutely.
exercise. Yeah, no, it's
All right,
very,
this was-
these are very insightful in terms of the processes and the gaps that we have to fill.
This is Carlo, DRC EMS Region 3. Just one thing I'd like to reiterate and kind of stress and make everyone understand, like Charles mentioned, until there's a declaration of evacuation, it'd be on the individual patient, family responsibilities to go through the local EMS to be evacuated if they want to do so before, during, if there's a declaration. So a lot of people don't understand that. We just want to make sure. Now, after the declaration, then of course the state's going to activate the talk, and then we could work on evacuating at that point. But for Francine, it was pretty late in the game when we did this, and it was still not officially a declaration. It was y'all had got a bunch of responses. We received a lot of responses of assistance. So the state was kind enough to open that up and open talk to get those units to evacuate. So just wanted to stress that.
Thank you. Yeah.
Beats Region 3 GOSEP, our biggest change is that Lafourche Parish will no longer require a placard to get back in. However, you will still need that letter in your badge. You must be the only person in your car. You cannot have your friends, family, anything like that. But if you are coming from Jefferson Parish in New Orleans, like if you evacuate that way, you still have to get their placards to get back to Region 3. But Region 3 will no longer require placards for reentry. And we do review your list every Friday. And our biggest missing component is what kind of resource they want. They have, paratransit, they have EMS, they have ambulance. And any ambulance, any's fine. That way we know exactly what we're but the ones that are blank, it just lets us kind of like wonder, like, do we need more EMS? Do we need more buses? So for us on a planning side for evacuations, that is our biggest missing link.
Okay. I will take a look at that and try and get our providers in Region 3 to make sure that they're choosing what type of transportation would be needed for that particular patient.
And last but not least, we're no longer printing the hurricane brochures because, as you can see, those maps change every day with people's names. So I'm going to send you the QR code. You can download it, and it should be in real time. Like, Mr. Jimmy just left, Mr. Ross just came in. That QR code should get you the information in real time rather than waiting for another printing to come out. And I'll send that to you.
And I will 1390, and I will update my emergency manager list to include Mr. Ross, Mr. Meir in that one before I put it in the calendar invite today.
And you'll meet him next week. He's just like Mr. Jimmy.
Thank
Same
you.
personality of it. It's no
The
distraction.
meeting next week is in the government consolidation building.
Yeah, Terrebonne Towers.
Terrible. It's same place where we've met last year. I take
sir.
it, right? Yes. Okay. And all providers are welcome to attend that meeting from 9 until noon next Wednesday.
Especially if you've not had a chance to meet with your parish OEP, that's the best chance to grab them or myself.
A fantastic way of meeting them. Yeah. Any questions from the provider community? You mentioned post event travel credentials. So they don't have to have placards anymore throughout
No.
Region 3. Is that what I'm hearing?
That is correct. Around Region 3, you just need your letter from your employee and your badge.
Your badge.
If you don't have a badge, just have the letter from your employee.
Okay. Great. Thank you. And with regards to, I'm just trying to help our providers. We hear, mandatory evacuation or shelter in place. Do you have can you provide any insight as to when that trigger is called for, rather than shelter in place, a mandatory evacuation?
If it is too risky, like if you go back to Charles's slide with the timeline on it to make everything work perfectly, those storms are coming at 108 hours away.
Right.
Ida nor Francine even gave us 42 hours.
Yeah.
Both of those were just way too short a notice. So, I mean, you're really just sitting there with your parish president, make a decision at sometimes in the middle of the night, like it's coming in 14 hours. Do we want to put everybody on the road? Mandatory evacuation. You cannot get a contraflow order prior to 50 hours. So you have to make the best decision for putting people on the roads. And at these little bayou roads, there's not an interstate to get you out of here. Most of the lanes are one way going, one way coming, to get to a 2-lane highway, to maybe get to a 4-lane highway. So it's just, if the storms would give us more notice, we would do a much better job at it. But sometimes it just becomes a situation where we know something's going to happen really bad, but it's safer for you to shelter in place.
And we have to remember, we're talking about 300,000 people in this one region. And
Yes.
that's a lot of folks to get out of harm's way.
But in a perfect scenario like the timeline represents, if we know Ida's coming at 108 hours and we can get contraflow established, more and more they would be calling for these mandatory evacuations. But sometimes it's just too late in the game to put that many people. You're going to put more people on side the road than just kind of being in their homes.
You know, Region 4 has had some long standing construction issues that can complicate evacuation. Yes. Are there any big construction issues going on that providers should be aware of that might interfere?
Our issue has now moved to Region 4 because it's in New Iberia. Right. So when y'all have the Region 4, when Mr. Ross will be on there with the new maps, the new detour, but it's officially out of Region 3. It's just further up Highway 90.
Okay, great. Thank you. Thank you.
We were glad to see it go too.
Yeah, I'm glad it's finally completed. I do want to remind.
It's completed for here. It's not completed for Region 4.
Right.
Region 3 smooth sailing now.
Right. I do want to remind all of the hospices and home health, especially the hospice agencies, we have a new feature in the at-risk registry, a new column in the at-risk registry. Right after needs assistance, there is a toggle between actively dying, yes or no. If the patient's not actively dying, just leave it alone. But if they are, that's when we want you to mark it with a yes in the toggle. And when we talk about someone actively dying, it's a patient who's non-responsive, who's transitioning towards that, that 72-hour active phase of dying. And if, most hospices have enough experience with managing the dying process that they know when patients are approaching that active phase. And so we ask you, when you start noticing that with your patients, to make that notation in the at-risk registry. It just gives emergency managers a little bit more information with regards to the fragility of that particular patient, so they may be handled differently. We do have anybody, if you are involved in any of these other regions, we do have region Mississippi District coming up next week, and then we'll be in Region 2 and 4 in the following weeks. You can sign up just for those regions, or you can sign up for all of the weekly calls. I do want to remind everybody that we have set up now these regional folders for LMH, PCO, and HICLA members. If you are part of our organization, you can now sign in, and we are putting any type of material that we receive from those regions into those folders, so that you will have access to the latest information as it's coming out. And we're also giving the regional managers the access to these folders, so you can place any material you want to go to the provider community into the website, and they'll get notices that there's a new file that's been put into there. I did make a video tutorial back in May on using the at-risk registry. If you have folks in your agency that need a refresher on how to use the at-risk registry, this is a good way to just click on it and you can watch the video. Or there's also a 2-page tutorial, written tutorial that you can use for educating your staff members on the proper use of the at-risk registry. I want to thank Allison in Region 2 for providing these resources that might help you in your planning for this hurricane season. We send out reminders every Thursday morning to do the update on the at-risk registry. If you're not receiving that update, please let me know, and we'll be more than happy to send you that reminder. CMS has just posted a new page, a new website on disasters and emergencies. And our next meeting is next Wednesday, same time, same place. I'll be in Homa for this meeting and probably broadcasting from them, but we will have this meeting at 1 o'clock where we'll be looking at the Mississippi Gulf Coast. In the meantime, does anyone on today's call have any questions before we leave the fine folks in Region 3? Morgan City still has one bridge over the Atchafalaya. Reminding everyone, Morgan City has only one bridge over the Atchafalaya. Well, if there are no more questions, I want to thank you all for being with us today, especially our ESF 8 partners and managers in Region 3. In the meantime, please be careful. We have a wonderful holiday this weekend, but we may get some rain and some storms through there. But be careful, play it safe, and we'll see you next Wednesday, same time, same station. Bye-bye. Thank you, Charles. Thank you all, Ashley. Thank you all for coming together and doing this today.
Thanks
Thank
for
you.
having us.